Now, a moment created by our sponsor, Blue Cross Blue Shield Association. And for that, I am pleased to introduce Maureen Sullivan, Senior Vice President of Strategic Services and Chief Strategy Officer of Blue Cross Blue Shield Association, joined on stage with Kevin Goldman, Senior Director of Strategic Communications and Global Health of the Media Practice at APCO Worldwide. So, Maureen and Kevin, the stage is yours.
Everybody, good morning. Good morning, Maureen. Good morning. So, like I said, Maureen is the Chief Strategist Officer at Blue Cross Blue Shield. And how long have you been there now?
He knows the answer to this.
I do know the answer.
A lifetime, 30 years.
So she knows what she's talking about. So tell me, we're going to talk about Blue Cross Blue Shield Access today, and it says that Access public data info, it puts data info into the hands of employees and employers, so better decisions can be made about the cost and quality of care. So what does that mean specifically in plain English?
Well, and we just announced Blue Cross Blue Shield Access in September, and if you think about the conversation you just heard about where data are needed, to help consumers make decisions, to help providers actually change the practice of care to be more outcomes-oriented, to help employers design benefits, we have committed nationally across all the different Blue Cross Blue Shield companies to a data asset which we're naming Access. And it includes the 350 billion claims data, and we have 105 million members across the country. Includes provider data, quality data, reviews. We have almost 1 million reviews by individuals who have based on physicians or hospitals that we include as well. So that data asset is now fueling what's happening in local markets with Blue Cross Blue Shield companies. And we are forming a research consortia that will enable us to have academics and others look at the kind of data questions that you heard earlier of understanding practice of care and where improvements can be made.
Okay, so what was not put in the introduction is that before I joined APCO, I was a reporter at the Wall Street Journal, so I tend to ask very basic questions. So if we get this, but when you talk about data, specifically, what kind of data goes in, and what do I see, and what does an employer see?
So it's a great question because an employer, for example, has the information that they're designing benefits for their employees, and they want better information on where the employees are accessing care and for how much and what the outcomes are. And they're able to get now, our Blue Cross Blue Shield companies are working with the employers to actually give that information. And what we see happening as we look at improving health and what we're delivering to employers is their ability to actually design the benefits based on their employee base. Looking at, I have my associates in these states, these are the issues they have. Let me see what kind of innovations are in those local markets that they could tap into.
And what about me as an individual?
Individuals can access data through the Blue Cross Blue Shield companies to get the kind of cost data or quality data as they're accessing, if you have to have a procedure done, let's say you have to have your knee replaced, and you want to know what is available in your market. Who does the knee replacements? What's the cost? What's the quality? That information's available. And where you're seeing the advances, what's exciting, is we're looking at not having it static, that if you have the time to go check it out because you're very motivated, instead we're looking at ways in addition that we can get the data to you when you need it at the right time in the right place. And that's sending alerts, connecting information in a much more meaningful way than we have before.
So all this data is floating out there. Is there any concern about privacy?
Absolutely, and we have very strict standards on the cybersecurity, but beyond that, the access cost data, for example, is all de-identified, it's aggregated, and so that information that's made available it doesn't have any of that information in it. But we're very careful about that.
Oh, okay. And the panel before spoke a lot about data. They must have said it about 150 times if they said it once. But isn't the data only as good as the way people use it? So how can people use it, individuals use the data in order to benefit themselves?
Well, and that's where we see advances. And you heard some of that in the last panel where there were examples given of how data are being used differently. I was at a session earlier this week where one of our Blue Cross Blue Shield companies was sharing what's in development. And they're looking at individuals that are discharged from the hospital, that they would have a wearable device that can share the information with the health management coach that's making sure that they are having effective reentry, that they would have the pill boxes that can see whether the pills are actually taken, and that all that information can be then combined to interact directly with the individual at home. So how it's being used today is going to change as we go forward, and you see those investments being made now to leverage data in even more meaningful ways.
Okay. By the way, I noticed that there was, I asked you this earlier, but speaking of data, there was an op-ed piece in today's Times about a doctor advocating for house calls and how data, the data of the individual person could be found by just observing. Like this patient that the doctor went to see was eating sodium-laden soup, and it was contributing to the downfall of his health. Any thoughts about from Blue Cross Blue Shield about house calls and how that could maybe help decrease the cost of health care?
Well, and it's interesting that part of what I had mentioned was that some of the Blue Cross Blue Shield companies are looking at, can you make house calls happen through technology? Is that a way that you can bring it into people's homes in a much, part of what we worry about with 105 million members is scale. We have a lot of pilots running. You can make that innovation happen in a small way, but we want to make it happen much more broadly.
Oh.
And using technology may be an easier way to make that happen.
Right. And there's tension now, going back to access, there's a tension between insurers, hospitals, and doctors that they don't always see eye to eye. And are we entering a new phase where insurers and providers are able to collaborate on the data initiatives?
We see it. We have, you heard comments earlier about the value-based care and the movement to that. And what does that mean? It means changing the way we pay so that there's outcomes, both on cost targets and quality targets that are met. And that requires data. How are we doing? And we have formed, the Blue Cross Blue Shield companies, over 570 of these programs around the country. And I refer to it as the quiet revolution. It's really transforming care. There's one example that I often use in Michigan where it now reaches 2 million of their members. And it's a group of patient-centered medical home that's much more integrated. And they have the data that they're able to provide the kind of support to see the behavior change that's needed. What I was interested in the earlier panel is you can't have any one party just have the data. It really has to be integrated. It is the physicians. It is the individual. It is their support system as well, having the kind of information they need to help improve health. So we're finding that the partnerships are there, that physicians and hospitals do want to work. They understand that we are in a healthcare system that is unsustainable unless it changes.
Right.
And we see data as the engine toward that.
Right. And my friend Steve from The Atlantic mentioned on the panel that virtually they were all wearing Apple Watches, so people are interested in data. But how do you get, and then somebody remarked that they were all upper middle class, how do you get people, the population that may need it the most, to get well informed about data, to use it, and to be educated? How does Blue Cross Blue Shield do that?
Well, that's an important question, because if you look at the exchanges, the public exchanges that were just launched, Blue Cross Blue Shield is the largest player on the exchanges. We have millions of members that we've enrolled, and it's a very different demographic. Many are unfamiliar with insurance. They might not have access to primary care. They're skeptical about entering into the healthcare system. And we're doing a lot of research and understanding those consumers and their needs and looking at how you build that support within the local communities, because it's a different set. One plan in Florida, our Blue Cross Blue Shield company is looking at whether a different clinic system is going to help and be more of a way to reach the Hispanic population than the current system that's there. So it really is in tandem, not only just providing data to members, but really looking at how it integrates with the delivery system and thinking creatively about the new ways that healthcare can be delivered, which is really important.
Do you think it's going to be an obstacle to get private citizens to be welcome to sharing data because they might be skeptical, oh, this is Big Brother, this is the government who wants to see everything about me? Is there a danger? Or how do you convince ordinary citizens to share the data?
Well, I think, there's some data that individuals may keep just for themselves, right? But there's data that we have as an insurer that we can integrate and combine with their data to make available to them. But any of us think about privacy and need to be sure that we're comfortable. And what our perspective is that we need to make sure that we put our company to the highest standards and make that data available in a way that improves health.
Going back to access for a second, are your competitors doing something similar, or is Blue Cross Blue Shield leading the way in this?
What's different about Blue Cross Blue Shield is that we're in every zip code across the country, and we have the data depth that's really unparalleled. And it's one of the reasons why we're holding ourselves to a high standard as well on sharing that data. So we've started a Health of America series this year where we're looking at trends in data, knee, hip price variation, cardiac, what's the difference in treatment for women after heart attack. And we have a set of things that we're looking at and publishing now to make sure that that's available. And it's just a different level of data that we have that our competitors are unable to match.
Sure. And about 10 years ago, I was at the Herb Allen Media Conference out in Sun Valley, and there was a speaker there, Jay Walker, talking about how we won't have to go to the doctor anymore. We'll be wearing basically every device that will be measuring constantly what our blood pressure is, what our heart rate is, and we're slowly getting there. But access and the data, where is this all going? Where do you see it going in 5 years or beyond?
You know, what I see, and we're seeing around the country with the kind of innovative experiments that Blue Cross Blue Shield companies are doing, is that the data will be much more available to us in a way that is easy to access. And now it's not as easy. I mean, any one of you who have had a healthcare crisis for you or someone in your family, it's hard to figure out. Where do you go? Where's going to be the best treatment? And I think that information will be much more readily available. And, I said earlier when we were talking before this, that with a long career in healthcare, I think that we're at a pivot point and that this is one of the most exciting and hopeful times in healthcare, that we're really going to be able to leverage the kinds of changes that are going to change health in a meaningful way. And when you heard Esther talk about communities, we're in every market improving health in those local communities. And I think we're going to have the tools and data to do that. And I think that's exciting.
And when you also start thinking of questions, I'm going to throw it open in a second, but some have argued that our ability to collect data has far exceeded the ability to derive real intelligence from the data. I'm wondering what your opinion is.
Collecting, to create access took years, to be able to get the data together in a way that it was measuring in a similar way across the country. And it's going to take years as well, and it's going to exponentially grow that we're going to get insights from the data. I think it's already at a much higher level than it's been before in the very examples that you've heard today on how data are being used, but I think it's going to increase exponentially.
Right. Do we have any questions from the audience? Yes, sir. Wait for the microphone, please, and thank you so much.
Hi, my name is Jim Lebret. I'm
Hi,
a
Jim.
provider, and one way that providers make sense of the data is in story. And a lot of the raw data doesn't have a story to it. Is there any way that you at Blue Cross Blue Shield, or have you seen any others creating stories with data to really allow the consumer to access the heart of what that data means?
Yeah, it's interesting because when I've presented on the impact of the innovation in local markets across the country that we're seeing, and I start sharing the results, and I talk about, ER utilization is down, and preventive care screenings are up, and I can quote the numbers, and I go through it, and it doesn't have the impact as the stories do. And when you tell the story about an individual who's overweight and their diabetes is not under control, and what can happen in those patient-centered medical homes in a meaningful way that helps that individual change their behavior, that story is what stays with you, not the fact that I said the ER utilization is down 10.6%. I mean, it doesn't stay with you. So one of the ways that we're looking to make that more available, because there is such innovation, is actually creating videos and snapshots of the stories of what it means to an individual, these changes in healthcare, and we're going to be making those available because we think it matters. I mean, I agree with you.
Any other questions? Yes, sir. Back.
Hi, I'm Steve Clemens
Oh.
with The Atlantic.
A voice from the past.
I just want to ask you an honest question, as opposed to one but as you model as you model the future of healthcare, and you look at where we're going, and you must be like the Wizard of Oz and have so many groups that you see what's happening really behind the curtain in so many health ecosystems. As we get healthier and healthier, if we're successful and we invent a healthier country, is there enough profit in that? Is a healthier nation profitable enough for the healthcare system that's trying to generate that?
Absolutely. I mean, the comment was made about investing in health. I mean, what we're spending on healthcare, we need to spend better. But the fact that we're investing in health and spending a lot on health is a good thing. I mean, we live longer. We're living healthier lives. The numbers speak for themselves today, and I think our ability to live even healthier in the future, it not only affects the healthcare industry, but affects all industries in terms of productivity. So I think it is absolutely going to pay off.
And one last question, please. We have time for one last question up the aisle. Thank you.
I'm Joan Randall from the Nicholson Foundation.
Hi, Joan.
You said that you were making data available from local markets. We've been trying to get data. We'll pay people to analyze it to improve health in local communities from one of your companies. We haven't been able to get it. Could you tell us how we can?
Sure. Sure.
Medicaid patients.
If it's a specific market, it's facilitating the discussion with the local Blue Cross Blue Shield company. Nationally, we are looking at just forming, so it's new, it wasn't there before, a research consortia which would enable researchers, academics to come in and be able to access the data in a controlled environment, to be able to take learnings from it. And so if you're interested in something that could possibly be accessing national data and we have it, you could put a proposal together and we could have those discussions. I'd be happy to give you my card. But being able to provide the data to many in a controlled way, again, making sure that it meets the standards in terms of security, is very important to be able to get the learnings and the innovation. I mean, it's not something that we're going to be able to do alone. And that's part of what Blue Cross Blue Shield in local communities does all the time. So we'd be happy to help.
So I just want to thank, do we have time for one more? All the way back there? Thank you.
Thank you so much. This is a question follow-up to what Richard Sullivan said about investing in health and prevention. What about coverage of things like acupuncture, functional medicine for people who have a health problem, and they can be treated with 1 or 2 visits, and the cause of the problem will go away, and then they live a healthy life. But the insurance companies usually don't cover those kind of alternative medicine and spend lots of money on the traditional or conventional medicine, and the patient doesn't get well, and it goes on, and the cost of health as a result is high, and the patient gets sicker. So my question to you is there a future plan of the insurance companies to consider functional medicine and other alternatives for patients?
We are seeing that in some markets already, where Blue Cross Blue Shield companies are looking at covering that. So it does vary. I mean, it's part of working nationally. We see that variation across the country. But I do think we have to be open to how coverage may change. I mean, if you think about the role prescription drugs played in our healthcare dollar, it used to be a lot less. I mean, now it's at least a quarter of that dollar. So when we think about what we need to pay for, we do think it'll evolve. So I think there are opportunities.
Thank you very much. Maureen, thank you so much. She's going to be here throughout the morning and through the lunch. She's wearing this bright red dress, so you can see her. So if you have any more questions about Blue Cross Blue Shield access, be sure to approach her. And thank you very much for your attention.
Thank you.
Thank you.